This inductee pioneered the active engagement of patients in their own treatment and supported them in shared decision-making with physicians and caregivers. Dr. Annette O'Connor.
Well, I was born in Moncton, New Brunswick, but Canada was our neighborhood during our 14 moves as a military family from Newfoundland to the Northwest Territories. I was the oldest girl of 7 children, and we learned to share and to care for one another and to adapt to very different communities and schools. Well, during my PhD studies, I was captivated by a new field called medical decision-making that analyzes difficult decisions. I was inspired to pursue this line of research to better understand patients' decisional needs and to improve the decision support that practitioners provided.
She looked at how you could help patients to understand their treatment options and how you could bring together complex medical evidence in a way that patients could understand.
She's the godmother of patient decision-making science, and the theories and frameworks and measures that she's developed have been foundational to the field.
Specific interventions and resources that Dr. O'Connor's developed include the Ottawa Decision Support Framework, patient decision aids, the decisional conflict scale, and training in shared decision-making.
I also led the first international reviews of patient decision aid trials and a 14-country consortium to set international standards for their development. I also co-led a 6-month Oxford Forum on shared decision-making.
And demonstrated the benefits of using decision aids with patients, and that was a Cochrane review published in the British Medical Journal.
She developed a website that allows patients around the world to access patient decision aids that are available.
Going back to the 1990s, all of her research teams, when it was quite uncommon, were interdisciplinary and included physicians and patients and nurses and allied health and epidemiologists and social scientists.
And she and her team have had a major influence on the field internationally.
The Oxford Forum fostered a new biennial international conference on shared decision-making.
And now there are governments, policymakers in healthcare around the world recognizing that we've got to get this right.
She also informed the legislation in Washington State that changed consent for healthcare to a consent involving patient decision aids for surgical decisions. And she influenced the Obamacare legislation that was released in 2010.
The impact of it spread throughout the world.
All of her work has been grounded in the patient experience and patient need. And so she really epitomizes patient-centeredness long before the term became fashionable.
And that is leading now, 30 years later, to a transformation in the way people think about medical decision-making.
I'm proud to be a founding investigator in a new field of shared decision-making and to see the next generation's contributions to this emerging field.
Canadian Medical Hall of Fame Laureate, Dr. Annette O'Connor.
This medal spotlights my field of shared decision-making, and I am so grateful for the collective efforts of our Canadian and international community that made it possible. A community of interdisciplinary researchers, students, clinical teams, and especially the patients. Patients participated every step of the way, from identifying their decisional needs to developing patient decision aids that prepare them to discuss options, to setting decision aid international standards, and to training clinical teams in shared decision-making. Thank you to the leaders of the Ottawa Hospital Research Institute and University of Ottawa nursing and medical faculties who supported our Health Decision Center, notably Marion McGee, Denise Alcock, Monique Bégin, Peter Walker, and Ron Wharton. I'm enormously indebted to our outstanding Decision Center team, with a special shout out to our long-standing researchers, Peter Tugwell, George Wells, Andreas Lopakis, Ian Graham, Jeremy Grimshaw, Jamie Braho, and Anne Cranny. To our research staff, Liz Drake, Erica Vollins, MJ Jacobson, Sarah Kangura, Anton Saramaki, Debbie Morris, and Carol Bennett. And to former students Dawn Stacy and France Legaret, who today are recognized nursing and medical leaders in the field. A special thanks to my pioneering international colleagues who invited me to work with them in their countries in the early days. In the USA, Hilary Llewellyn-Thomas and Jack Wenberg at Dartmouth, and Margaret Holmes Rovner and David Rovner at Michigan State University. In the UK, Angela Coulter and Weir Gray at Oxford, and in Chile, Ilta Lange at the School of Nursing, Pontificia Universidad Católica de Chile. Our generation laid the foundation, and the next generation deepened our understanding of shared decision-making and broadened its use around the world. At our last international conference hosted in Quebec City, I was heartened to see researchers, students, and patients discuss their progress and prospects in Canada and abroad. Their know-how has never been more crucial during this global pandemic, with its urgent and rapidly changing decisional needs. In closing, I'm enormously grateful to my family for their steadfast love and support. My daughter-in-law, Cheryl, my son, Dennis, and my husband, Sean, who has been my soulmate and Rock of Gibraltar for the past 46 years. Thank you, everyone.